urgency incontinence or overactive bladder is the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy in Irvine, Orange County. Urgency incontinence or overactive incontinence is one of those things that people have a lot of challenge with. So it's essentially when the bladder contracts, but the contraction of it is less of a disease issue and more of a behavioral issue. So when it comes to urgency incontinence, a lot of times not a lot of times, there are times that they give medication or there's a surgery case, but most of the times it's a behavioral issue where the person goes to the bathroom just in case. So they don't really get to practice, the nerves don't get to practice holding on, and the tissues don't get to practice to really stretch to then eliminate. I've done a video on the whole nerve flow and the nerve construction of the bladder, so to speak. We're going to make sure we put it at the end of this video so you can understand what I'm talking about. But if you don't practice it, if a tissue doesn't get to practice to stretch and hold, then it won't have that ability to do it. So a lot of times the behavior needs to be addressed. So a bladder diary is helpful. I've written a blog on the very subject. We're gonna make sure we put the blog information in the description box so you can really get into it. But I just wanted to bring it to your attention that there are a lot of things, in my opinion, when it comes to urgency incontinence that are totally being overlooked, and that's probably the worst mistake you can make. There's a nutritional component to the incontinence in general. There's postural component, and then there's a breathing component that, from my perspective, I think people are misunderstanding. At least if you look into the other videos, a lot of times maybe the terminology is not right, maybe the way it's being shown is not right. I'm going to do a video on that, so make sure you subscribe to the channel so you see all the videos I do on the subject of pelvic floor dysfunction in general. Thanks for watching. Take care.